Right. So, hello and ali to all. My name is Whitney. I am truly honored to have the opportunity before you today and introduce my island nation, the Republic of Palau. Um, Palau is a gem in the heart of the Pacific, and it's a land rich of history, vibrant cultures, and stunning natural beauty. There are about 300. There are about 300. I'm sorry. There are about 300 islands, and about 284 of them is populated. Um, I'm sorry. Yeah, sorry. The archipelago extends for about 240 kilometers, but the length of Palau volcanic arch is about 350 kilometers. With a population approximately of 20,000 people, our small island nation is a tight-knit community that takes immense pride in our heritage and commitment to preserving the environment that sustains us. Our demographics reflects the incredible diversity that defines Palau. We are a melting pot of cultures with influences from Micronesia, Asia, and Europe, and shaping our way of life. Right? You will probably know our country for the famous Jellyfish Lake, our rock islands, and our pristine and silk-like sandy beaches. We have one hospital, the Belau National Hospital, together with public health and its network of 8 satellite clinics, also known as dispensaries, complement the central hub of the 8 strategically located satellite clinics, extending to our reaches to every corner of our island. These clinics serve as a vital touch point, ensuring that quality healthcare is accessible to all regardless of location. Okay. Sorry. Our journey begins by acknowledging the incredible strides we've made in our healthcare sector. Our dedicated healthcare professionals work tirelessly to ensure the well-being of the people in Palau, backed by advanced medical technologies and innovative treatments. However, even if in the face of such progress, we must confront a significant challenge that has persisted over time, and that is the management of paper-based data within our healthcare system. And in the grand world of medicine, where precision is paramount, it's quite entertaining how doctors' handwriting can sometimes resemble a hurriedly written grocery list after a caffeine overdose. But amid all the humorous banters about doctors' handwriting, there's so much truth to these scribbles, right? And these scribbles are often the result of hardworking professionals caught in a whirlwind of busy schedules, late nights, and endless patient care. And so in the end, doctors' handwriting is a quirky emblem of the medical world, a source of amusement that bridges the gap between medical practitioners and the people they serve. So the next time you find yourself, it reminds us that behind these white coats and stethoscopes are human beings who, like all of us, succumb to the pressures of time. So the next time you find yourself deciphering a prescription that could be mistaken for an ancient runic inscription, remember to appreciate the chuckle it brings and the dedicated professionals working tirelessly to keep us all healthy, right? Even if their handwriting seems to hail from a parallel universe. And along the lines of rapid technological advancement, we find ourselves heavily relying on digital solutions, and which have transformed industries and empowered societies. However, as we navigate through the digital age, the healthcare sector often grapples with the inertia of maintaining traditional paper-based data and records, grapples with the inertia of maintaining traditional paper records and data. Today, we'll delve into the challenges posed by the reliance of paper-based data in our Palauan healthcare system and explore how embracing digital alternatives could pave the way for more efficient and secure patient-centric future. Oh no, it doesn't want to do that. Uh, so sorry about that. While our country is undoubtedly known for its breathtaking beauty and vibrant culture and warm hospitality, we must also acknowledge the areas where we need to evolve. Our healthcare system, although commendable in many ways, stick with antiquated practices of relying on paper-based medical records. And this outdated approach not only hampers the efficiency of our healthcare services, but also with the efficiencies of managing patient information. The storage, retrieval, and sharing of paper records are time-consuming processes that hinder the quick and accurate delivery of our healthcare services. And the physical storage requirements are substantial and occupying valuable space within our healthcare facilities and posing risk and damage and loss due to natural disasters, accidents, or simply deterioration over time, which is what happened in our prior to implementation, right? Um, we did face challenges. Implementing Tamanu into Paya and M-Supply posed several challenges, such as absence of adequate computers, which is probably something we all experience in the Pacific, which is funding, right? Uh, in which our facilities were significantly challenged prior to implementation. One of the key challenge is the complexity of integrating systems into existing workflows. Um, as as time is going on now, we're starting to see a change in the medical field, where we have young doctors coming aboard and try to contribute to society. And so, with that in mind, we also have the seniors, which is very hard to kind of change those practices, those existing workflows as they're so used to face-to-face interactions. So, okay, no, you're fine. The methods, then the other challenges were methods that were adapting the system demanded a significant shift in their established methods, necessitating proficiency in technology. Thank you. Use the learning curve associated with mastering these new software and interfaces. The learning curve, the learning curve associated with mastering these new softwares and interfaces may have hindered their seamless traditional processes, and moreover, training healthcare professionals to effectively use the system was proven a challenge itself. A shortage of staffing was another factor. Even the adaptation to new technologies demanded substantial efforts and resources. Balancing these technical and operational and human factors were essential for the success of the implementation, which we have almost rescinded. Okay. 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 Also, with manual inventory management in pharmacies front several challenges. Firstly, the process is prone to human error, which leads to inaccuracies in stock, potential stockouts or overstock situations. The sheer volume of pharmaceutical products, each with specific expiration dates and storage requirements, make it difficult to track efficiently. However, regulatory compliances such as tracking controlled substances became more complex without automated systems. Manual inventory management also lacks real-time insights, hindering informed decision-making and preventing timely adjustments to demand situation. Overall, the challenges of manual inventory management in pharmacies highlighted the need for modern technology-driven solutions to ensure accuracy, compliance, and streamlined operation. Manual data compliance for healthcare institutions must gather and consolidate vast amounts of patient data, treatments, records, and financial information from various departments and systems. The labor-intensive process increased the risk of data inaccuracies, potentially compromising patient care and decision-making. And moreover, the manual approach is a resource-intensive and diverts valuable staff time away from more official tasks. And so we launched what we call Project Olang. And so Olang in our language is a literal translation is to identify or mark. And so after the implementation of Tamanu Tupaya and M-Supply, numerous benefits did emerge with Belau National Hospital. The system enhanced the accessibility of patient information, leading to improved clinical decision-making and patient care coordination. Our health professionals can now easily access medical records, reducing redundant tests and treatment delays. This efficient sharing of information was also facilitated to better communication and leading to a more comprehensive and holistic approach to patient treatments. Additionally, with the power of Tupaya, which paved the way for data-driven insights, enabling management to identify trends, enhance health reporting, and ultimately contributing to better patient and hospital management. And so these are 5 of the key benefits that we saw that after implementation was really beneficial for us. Efficiency and accessibility, which is, Tamanu's ability to centralize the patient's data. Gone are the days of digging through mountains of paper records. With a few clicks, medical professionals can access patient information. Efficiency of access to information eliminates redundancies, and people can access this whether you're in the north, the south, central. Patient care, the ability to access patients' complete medical history. And so we're projecting within the next year or two, we will eliminate our medical records department to a very small space. And with that, our medical records is probably half of this conference room for the hospital. And so those are very valuable space that we can utilize for other clinics or other new departments that we can put into our services. Data-driven insights, again, the wealth of data stored with Tamanu can be harnessed for reports and analytics. Integrating with Tupaya can facilitate the identification of trends and comprehensive management reporting. The integration of M-Supply's tender module revolutionized the vendor selection by providing a sophisticated and efficient approach. The module empowers our procurement team to evaluate vendors by considering multiple factors. And then the security and privacy places a strong emphasis on data security and patient privacy, which protocols safeguard patient information for unauthorized access. And so I want you to step into our world of transformative healthcare after our post-deployment with this brief clip showcasing the successful post-deployment impacts of Tamanu. Yeah, it's a video. It's okay. So you can't see the video because of technical difficulties, but as soon as they post this presentation, you'll be able to see that video. All right, and as the successful implementation of Tamanu, Tupaya, and M-Supply systems, establishing a robust long-term ground support will be key to the successful um, longevity of the program, right? And so this support framework is essential to ensure the continued functionality, optimization, and seamless integration of the three systems with our healthcare ecosystem. Long-term ground support involves a dedicated support personnel who can work collaboratively to address evolving needs and providing ongoing training, troubleshooting, and perform system updates while maintaining data security. And I am that person. And so the support system with Tamanu work with BAS for the year while they train me and kind of work with their systems and that provide that long-term support later on after ground BAS leaves. And so with that said, thank you. Masulang.